Hey everyone, how's it going? My name is Jeff and I'm an occupational therapist who works in the hospital, often with patients who have had a stroke. And today I'm going to demonstrate some ways to put on a bra after a stroke. 5 ways, in fact. I'll be showing you actually in reverse order from the hardest and then to the easiest. And there's a really good rehab reason for that. Yes, normally without a stroke, we often want to do things the easy way, right? But what's different about learning and redoing things after a stroke is that how we do things after a stroke affects how we recover. Oftentimes, after a stroke, people lose function of one side of their body, such as in their arm. And at this crucial turning point, this is very important. How you do things affects the recovery of your body. Makes sense, right? Such as with like your stroke arm. What I am talking about is a concept of learned non-use. And our brain has kind of like a mental map of our body. For example, if someone were to like tap on your shoulder from behind, you would know exactly that you were tapped on your shoulder even without seeing it, right? What I'm basically talking about is the concept that you probably have heard about, or the saying, use it or lose it. And after a stroke, the brain kind of forgets about one side of the body. And even more so if we continue to neglect it. Some of you may have even noticed after a stroke that you may, for example, bump into things on one side of your body, like left side, for example, if that was affected. So many videos out there, like if you see them on like YouTube or your therapist may teach you, is they teach you how to put on a bra with one hand. And while there's nothing necessarily wrong with that, for the long-term recovery, the better thing to do is to use both arms to put on a bra, just like how you did before your stroke, right? Because if you only continue to use like one hand and one-handed methods for even everyday things, not just putting on a bra, the chances and the likelihood of you regaining your arm function back for your stroke side will be much more slim and not as good in terms of your recovery and your rehabilitation. Use it or lose it. And so on this note, I know that it'll be much more harder than it would normally be. It'll take more time. It may be more frustrating for you guys to try and use the harder of the methods that I will go over. But I highly encourage you to take your time, to have patience, and just keep practicing, just like with anything else in life, right? Because this will pay off in the long term for your future recovery. Not just something like putting on a bra, but for everything else. Because we as humans use our arms for a lot of things, right? An analogy similar to this is kind of like when you learn to tie your shoes. I could tell you to put on slippers, but maybe you just want to put on a nice pair of shoes. I could tell you to do it another easier way, maybe like wear Velcro shoes, but everyone has different preferences and needs, and that's okay. I could tell you to use special types of shoelaces or something, and some people may just want to do that. And some other people may just want to relearn it the way that they did it, or do it the way that looks more typical or more normal or what they used to wear before. So most people, for example, may want to use their own shoelaces. So instead of like buying new things, then this may be one of the options and kind of like the first option that you should probably explore in the first place, because you can always resort to something like buying new shoes, using new type of shoelaces, or using some of the other methods in the future if you can't learn this, it's just too frustrating or whatever, right? That's probably why you're watching this YouTube video, to learn something new. Also, I understand many people may not have the finances or the means to get new things like new shoes, or in this case, bras, right? For those of you who have even like larger cup sizes, it's just not necessarily easy to find the right bra that fits for you compared to what you already have in your closet, for example. And just like how there are many ways to tie your shoes, you can dead knot it. Like if you don't ever want it to come loose again, you could tie like a runner's knot if you're like gonna run a marathon, or the typical classic knots that most people learn when they're a kid, right? So similarly, just like how it took a lot of practice when you were first learning how to tie your shoes, time, patience, making a lot of mistakes, a lot of repetition, the same applies here. And it's not as if you just like gave up and went to straight Velcro shoes, right? Maybe some of you did, but I'm guessing that the majority of you who are watching this video probably ultimately learned to tie your shoes. So again, the main reason that I am emphasizing using both hands in the first method and the first thing that you should try is for the sake of your recovery. And so this video will be kind of like a really, really long video. It's more of like a compilation video, like one video to reference to see all the methods all in one place. So I highly encourage you all to kind of maybe watch this in multiple sessions to follow along, pause, and to jump around. I'll include chapter markers for you to kind of jump around. So I don't expect you guys all, you ladies really, to watch this all in one session. Feel free to do this like over many days, many weeks, months even. Even though most people will find this order from hardest to easiest, everyone is different. And some people may actually find certain like later methods harder or vice versa, like the earlier methods easier than others. And so this can depend on many, many factors. For example, how you put on a bra before, or how involved your stroke is, such as how stiff or floppy your arm is, what your body type is, what your bra size is, if you have pain with certain movements that prevent you from doing certain types of these like methods, and so on. Also, it's good to try different methods because it's just good for your brain and your recovery. The more methods that you try, similar to how like the more songs you practice when you want to play an instrument, the more you're learning and practicing and you get better at it. And so you're training your brain to retrain your arm. Just like how when you were like young, it took you like a lot of trials, falls to learn to walk, right? Last thing on the note of falls is safety. I want you guys all to be safe. So when you're putting on a bra, it may seem like it's a pretty safe task, but you should know that it requires some pretty good balance. You should be able to like sit and work with putting on the bra. And sometimes if you have difficulty with that, you may want to have some support like I do, like with a chair or leaning against a couch, or even if you're standing, you can have like a wall nearby. You may be leaning on it. At the very, very least, have something that you can grab onto, and don't do this kind of like in an open room with nothing else around you. Because sometimes, for example, even when people put like a shirt over their head and it blocks their vision, after a stroke, some patients are more prone to falling and losing their balance. So similarly, when you put a bra over your head, that's when I really want you guys to be careful and be cognizant of your balance. So method number one is for those people who have kind of like stiff arms. So your arm tends to like lock up and it's really stiff. The medical term for this is spasticity. You can use this to your advantage. Even though your arm may not be doing much in terms of like moving around and pinching and coordination and things like that, you can still use it because you kind of have a really tight grip. So I want to use that to my advantage as I put on the bra using this two-handed method for those who have a stiffer arm. If you have a really tight hand, something like that'll look like this, the goal is to basically get the fastener into this hand with a little bit of it sticking out. You don't want it completely tucked in your hand because you're going to want to have access to the clasp. You kind of just want a little bit hanging out, but you also don't want too much either because it'll be too flimsy and it'll be hard to work with. One side is facing in where you don't see anything, and then the other side needs to match up and hook it from the opposite end, like opposite in terms of like this, because you don't want it like this because it won't work. You want them opposing in. I mean, if you've worn bras, you know what I'm talking about. It's just worth mentioning when you line it up so you don't get confused. So just so you get your bearings, if I have a left-sided stroke arm, I'm going to bring the right cup and right clasp into my left hand. And if you have right stroke arm, you bring the left cup's hook into your right hand. So starting with my left, I'm going to use the right hook. First, really important, make sure it's right side up and not upside down. And then I'm going to put the right-sided hook into my left hand. And one easy way to do that is to basically open up your hand first. And then as you let go, you simultaneously slip it in the clasp into the hand so that it gets squeezed and pinched into your palm, in between your palm, maybe your thumb, and then your fingers. Kind of like if I were to pry my fingers open, and take your time with this, your fingers are really, really tight. Open it up, and then using my thumb of my working hand, kind of like slip it in, and then letting go. So I'll do that against my chest. And then from here, I'm going to want to bring my stroke arm around so that I can reach around and grab it from behind. So just going to bring my arm around as far out to my side as I can comfortably. The more you can bring it over, the better. And if you don't have much room behind you, you can kind of scooch forward. And one easy way to do this is to kind of like shift your weight from left to the bottom of your bottom to the right side of your bottom. So kind of like shimmying your bottom. So what it looks like is I lean my weight onto my right, and then I kind of twist forward, and then I put my weight onto my opposite side now, my left side of my bottom. And I can even use my working hand to pull and then bring myself forward in the chair. Another even easier way to do this, if you are starting out and not really comfortable with something like that, is to kind of bend yourself backwards. This is what my baby does when he fights me and doesn't want to get into the car seat, by the way. So similar, you kind of straighten out and stiffen out your hip, and that kind of makes you slide slower into your chair. And then from here, you can kind of like grab your armrest, or if you're really strong and really want to work on your kind of torso and your abdomen muscles, just try and do it without grabbing on anything. Ooh, that's hard. And now I have a lot more room behind me. So now I can bring the bra behind me, still making sure that it's right side up. You don't want to have it twisted, by the way. And then reach behind you. Should be pretty easy now to pull. And if you kind of don't have enough slack, just bring your hand even more to the side and try again. So I know this isn't the easiest and most comfortable positions, but it's good therapy because it works on both of your hands and your awareness of your left side, or if it's your right that you're practicing with for after a stroke. And just kind of match up. I'll make it a little harder on myself just to demonstrate. I'm going to go for like the second tightness setting here. And this part's pretty intuitive. You just want to hook it in one at a time. And then from here, I just want to twist it around and bring it so that the backside is forward facing and in front of me. So I'm going to use my left hand and kind of twist it around and supporting my left hand with my right. Like that. Now I'm going to use my right hand to loosen up the grip on my left hand and bring it across me here, the opposite of me, like I'm giving myself a hug with my stroke hand, and use it to grab on some of the bra to have it help. Because basically you want to give your left hand a job to do. So once to redemonstrate, I think I kind of cheated there. I want to bring it over, bring it down, open it up, tuck some of the bra into my hand, close it back up, and then grabbing both hands, just twist it in front of me. So it takes a little bit of like finagling. Opening it up again, repeat, bring it across the stroke hand, open up the grip, grab as much of the bra as you can. You can tighten up the grip. And what you can also do is put your hand over your other hand and help it support it in making a nice, strong grip like this, so that it doesn't slip. And then I'm going to simultaneously, using my right hand, push towards my left side. And if you're working with the opposite hand, it'd be the opposite side towards your right side. Have this loop more in front of you in the center. So instead of working in this kind of more difficult like area where you have less room, it takes more flexibility and you can't see as well. If you have the loop in front of you in the center here and lower, Now I can bring my stroke hand really easy into the loop, right? I can take my time with it too and like really see, put it in. And then now I can bring the strap over my left shoulder. And because it's lower, you'll have to pull a little bit tighter. And then from here, you can bring the left cup to your left side of your breast, basically. So I'm going to grab onto it. Same like kind of technique, hand over hand technique. Twist it over. Now I really want to line it to the center using the, like, for example, a bow if you have one, or the center on the, between the cups to line it up to the center here. And because your right hand is quite flexible, you should be able to really easily find the loop strap and bring it up. And there you go. And to make like fine adjustments, same technique. You would use your stroke hand to grab on, for example, here, and grab your stroke hand with your strong hand to make like finer adjustments. Okay, how do we get it off? It's basically all the steps that we went over in reverse. And don't worry, taking the bra off is like hundreds of times much easier. What I'm basically going to do is I'm going to start with my left side and trying to use my left hand as much as possible, the stroke side. I'm going to use both hands to get the stroke side off first. Reason being is because when I do that, it gets the harder part out of the way, and then I can use my non-stroke side to kind of wiggle out of the other strap much easier. So what I'm going to do is try and have my left hand to help grab the top part of the front part of the strap, I guess, and then simultaneously get it over. The goal is to get it as low to my elbow as possible. So that's my target here, my left elbow. So even if it's just enough to get it over your shoulder, I call that pretty good. And then from here, you can let go of the grasp. And you can just use your left hand to bring it down and pass it over your elbow. And if you have a really firm grip, that's okay. Just try and breathe. You can bring your hand across like so, and then wiggle it out of your hand. Bring your hand out, and then work on the other side. Much easier, right? Because your non-stroke side is much more like flexible and dexterous. And then so once you get your other strap off, you're gonna just do it in reverse, right? So it doesn't matter which way you twist it, but I think I'm going to use my stroke hand again to help, right? Even though it'll take longer, it's just good therapy. I'm going to use it, bring it to my right side again, and I'm going to kind of rotate it around. So I'm going to grab onto a good part of the bottom of the bra, and then bring my hand again over the other hand, twist. Again, let go. One more twist, or rotation, I mean, so that I can access the clasp and then have it grip onto a good piece of it. And then with the other hand, it's pretty intuitive from here, right? You just want to undo it by bringing it, loosening the tension towards the opposite side. And there you go. So now I'm going to show you, using a different bra, just so I don't confuse you guys, how to put on a bra using two hands, one that may be more floppier. So I'm going to, again, have my left side be the stroke side. And there are basically two tricks to this method for those of you who may have a more floppy arm. One is using gravity to your advantage. So as you naturally lean forward, your arm will dangle, and that frees up room so that you can work around like your armpit area. And similarly, when you kind of lean back against your chair, your arm will rest against it, and you can use that for kind of support and to kind of hold things in place. Now, the second of the tricks for those who have a floppy arm who want to use both of it is to use the thumb of your stroke arm to your advantage, kind of like a hook to hold things in place, because it'll kind of, your straps will stay there as a hook. Even if your hand's not doing anything, it's still being a good helper by hooking onto like the strap. And when we rotate it and bring it around the bra and bring it back so that the front is in the front, we're going to use the thumb as a hook to grab onto this time the top of the bra, so that we can use it to rotate and kind of help a little bit too. Even though it's not doing too much, it's still doing something. So to start, I'm going to use the same kind of orientation. I want the bra right side up. I want to bring the opposite cup to the stroke side. So with a left-handed stroke arm, I want to bring the right cup to the left hand. And this time what I'm going to do is, with the right cup for my left stroke hand, I'm going to find the kind of like the loop that is closest to the clasp here. So the clasp is, we're kind of like closer to where my pinky is. And then the loop is right here, right? So what I'm going to do is put my thumb right about here, where the loop is closest to that. Reason being is we want to access this loop. So what I'm going to do is, if my hand was just like floppy, I would basically bring it close to my body now, so that it's in a position that's closer to my body, so it's easier to work with. So maybe like somewhere around here, and it'll probably like fall down, right? What I'm going to do is hook that position of the loop that I was talking about earlier between my thumb and my index finger. So now it kind of stays in place here. And then using my other hand with it like so, I can bring it around and behind me. So what I'm going to do is, keeping my thumb up so that it doesn't fall off my hand, bring my left hand over to the side as far as I can. And I'll probably like fall a little bit, but that's okay. And now I can lean forward just a smidge so I have room to work behind me. And bring it behind me, the bra, entire bra. I'm still making sure that it's right side up. And you can kind of even throw it behind you and across. And you can reach around and feel it too once it's on the opposite side behind you. So my stroke hand is still being a good helper by holding onto the bra. And from here, I brought it around. And as you can guess, I'm going to find the, what do you call this thing? The fastener. It'll be maybe even like for me, it's a little lower, so I can still see and work around this area. Like so. Take your time getting this lined up right. It definitely takes a lot of patience, but you'll get faster as you practice. Sometimes the hooks may even become undone. And that's okay. Just make sure you don't skip or misalign any of the loops. Okay. Almost. Okay, I've gotten all three in. And then from here, I'm going to undo the bra from my thumb and bring it around. Making sure it's not inside out either. So what the trick here is to bring my stroke hand across and over the bra, like so, and then I can release and it'll kind of fall over, but still holding onto something. Then I can use the same hand over hand grip to bring the bra around. And do this as many times as you need to get the bra in front of you. But you don't want to go so far so that it's centered, because the first thing you need to do is to get your stroke hand again in and through the loop. So with it about here, the loop is right over like my stomach, and I can put it through easily. And you notice that I start off really, really low because this allows me to easily put my hand through, because my hand is probably going to be dropping and falling to my lap anyways. So you do that, get your hand through the loop, try and bring as much as the what do you call this? The strap over your stroke shoulder as you can. And then from here, same technique of the thumb hooking over the top of the bra. Just find whatever you can, and then grasp your stroke hand with your non-stroke hand to rotate, so that this time you really want to center it, like right about here. And then you notice that it's pretty centered. And then using my non-stroke hand, align it right, the right-sided strap. And to get it off, it's similar. Basically, you're doing everything in reverse, just like technique number one, using the trick of the thumb to hold on to the top of the bra to rotate and to undo the bra as well. So to start, I'm going to undo my stroke side, undo the other side, maybe even get it fully out of my arm so that it's free to work with. Now I need to get it off, the bra off of my stroke arm, right? So basically you want to, kind of like you're taking off a pair of pants, bring the bra downward. So what I'm going to do is use my stroke hand and grab kind of like the center of the bra here, and my thumb to hook the top again, like so. And then I'm going to grab my hand with my non-stroke hand to pull it down towards, and shimmy it kind of towards my hip. Because from here, now I can undo my non-stroke hand, rest it, and maybe even dangle it out in front of me. And this allows me to bring the strap off like so. From here, I'm going to do the same technique of using my stroke hand's thumb to hook onto something on the bra, across from it, like so, from the top. Make a firm grip using my other hand, and I'm going to simultaneously rotate, let go again, and reach across, hook with the thumb. Grip your stroke hand with your non-stroke hand, rotate again until you see the clasp in front of you. I think I have it pretty good in place, but I'm going to shift it over so I can see what I'm working with. And don't let go from here. You're going to want your stroke hand to kind of still help using that hook. And what I can do is lean back and just kind of relax. This is going to work to my advantage. One, so that I can see where I'm working with, and it's an easier position. And two, it kind of helps to strengthen up the grip by having the stroke hand rest against my belly at this point. Now the third technique is going to be a one-handed technique, and I call this the lap method or the t-shirt method. And basically the idea behind this is turn a regular traditional bra into more of like a sports bra. So what you're going to do is you're going to assemble it and close up the fasteners on your lap. And what's nice about this technique is that you can get the fastener as tight as you want easily because you don't have any tension and you can work in front of you. So for example, if I want the second to tightest setting, I can do that very easily without too much of a struggle. The hard part, I guess, with this technique is to not have it become undone. So just take your time with it as well. So I have it fully assembled, and I'm going to dangle a little bit so I can free my hand, and put my hand through from the bottom, not from the top side, through the loop of the hole. Bring it as far up to the shoulder as I can. Like so. I can even lean back a little bit. Find the opposite side and bring that up to my elbow. And then from here, you don't want to bring it over your shoulder just yet because you're going to want to find the part that goes over your head, right? The big hole, and just like a t-shirt. So what I'm going to do is I'm going to, similar to technique number 2, kind of use my thumb to grab now I'm going to grab the back side where the clasp is, and then use that as like a target to bring over my head. Like so, like a t-shirt. And then from here, I can kind of just slide it back and forth until it's in place. This next method is called the thumb method, and the trick is to basically allow your stroke hand's thumb to be kind of like a holder in place to get the fastener on in the very beginning. And then from that point on, you use the non-stroke arm to take over to do everything else. So to demonstrate, I'm going to find the loop with the bra right side up, closest to the fastener again. I'm going to just hook it, the strap over my thumb. And then from here, I could even like bend forward a little bit and bring the bra behind me to make some room. I can throw it across behind and around my back, and then I can reach for it the same way as before, grab the fastener, and then from here, fasten basically the bra. And the trick with this one is to really bring the bra across so that you have more room to work from the other side instead of having to pull a lot of tension with your right hand or your non-stroke hand, which can get tired from this. And what I'm using is kind of like all my fingers to help. And it helps to start from the bottommost fastener and working my way up, kind of like buttoning up a shirt from the bottom up versus going top down, because then I can't see what I'm working with as I get to the second and third one. Okay, so once I got the fastener on, I unhook it from my thumb, and I can even bring it down to the side. And now just bring it basically same position as before, the loop in front of me. Not so far across that I have more difficulty getting it in. So right in front of me, even lower is good again. So see, we kind of use the same techniques as we learned from the other ones as well. It kind of translates into the other techniques. I put my hand through the loop to the corresponding side of the correct sided cup. So left loop strap, and then I can twist it across, bring it over my shoulder, find the right side, the remaining side, bring my hand through that loop, bring the strap over my shoulder, and then adjust as needed. Taking it off, as you can guess, I can use the same techniques as earlier. Off the shoulder. And then bring it down towards my hip, low as possible. Lean forward a little bit. Undo the stroke side strap from my hand. Now both sides are free. And then from here, to do one-handed unfastening, what I'm kind of doing is a sliding motion. So like a brushing motion of my fingers toward the palm of my hand and my thumb. So I'm going to use kind of like the surface of my thumb to hold the one side, and then the other side brush the fasteners over it. And what I'm going to be feeling for are the metal kind of fasteners, and not so much the fabric. Grab as much and move as much of the metal piece as you can. The last of these methods is called the upside down method, and it works pretty well because you may be able to do this one standing up. And that's one advantage that this method has over, say, the lap method, where you kind of have to be sitting down to assemble the bra, or even like the thumb methods where your hand may kind of get away from you and it's hard to work around. With this upside down method, all you really have one requirement of is to be able to have your arm against you to kind of hold the bra in place as you put the fastener on. So either in sitting or standing, basically, as this is called the upside down method, you start with the bra upside down. Same kind of like setup. You bring the opposite cup and opposite clasp to the stroke side. So I'm going to bring the right cup upside down with the clasp kind of in front of me so I can work around it. Reach around behind me. And make sure it's not twisted up as before. And then find the fastener. Fasten the bra. So I'll go for setting number 2 in the middle with this bra. And again, start from the bottom going up so that you can see and not block yourself visually. From here, twist the bra over to the front. But again, don't go so far so that you have the loop all the way to the side. Have the loop kind of like in front of you so that you can put your stroke arm through it easier. And again, it may be easier to slide the bra lower so that you can bring your stroke hand through the loop. Another trick that I learned from another occupational therapist is leaning. So leaning side to side. So if you're in a chair or you're supported by a wall, leaning away from your stroke side allows you to kind of lift your stroke side arm and fit it through, versus leaning the other way, it gets it lower. So that's hard to work with, right? We don't want to do that. I want to lean away from my stroke side. That gets my hand higher so that simultaneously, as my bra is lower, I can bring the loop over, bring my hand through the loop, that is. And basically what I'm doing is I'm inverting the bra now from upside down to right side up. So same with this side. And I'm bringing it right side up. Oops. There. And to take it off, basically I reverse the steps just as before. This time I can even invert the bra upside down. If you have a wire, it might kind of dig into you. And then bring it out over my stroke hand. Twist it around. Same technique as before. That kind of sliding one. Like so. And before you guys click away, some last tips before you go. It's worth mentioning that there are other products out there. Just like how you could put on Velcro shoes. Well, these aren't as not as good looking as Velcro shoes, but there are alternatives out there. For example, a lot of occupational therapists like to recommend wearing sports bras because you don't have to deal with the fasteners of more traditional bras. Yes, this does come with some downsides. For example, sports bras may not provide as much support, like the cups. And especially if you get like sweaty and like really hot, it may not be as comfortable because it's more kind of like form-fitting, but that is another available option. I don't have another type, this second type with me, but I will post a kind of picture on the screen that my wife told me about is that they have front fastening bras. And these are bras that you can fasten in the front. And you can use some of the same methods that I've talked about in this video earlier to put on the bra this way. Basically, you just don't need to flip it around. You can just fasten it and you're done. And they have different kinds too, from like zippers. I don't recommend using zippers as opposed to hooks because it takes a lot more coordination to hook the zipper piece into the other like matching piece. But you should know that a third type of option out there, if you're really just kind of like more like just want to put a bra on and not have to worry about it and do it the most easiest of ways and not have to like practice, is they have like post-surgical bras, which I will also post on the screen, and I'll post some affiliate links in the description because these bras I think are really, really nice as they have a kind of Velcro feature and you can't really see this on the outside once you put it on. So it's not like everyone notices that you're wearing a Velcro kind of bra, but it's nice because it just sticks on and you don't have to deal with that hooking kind of feature that traditional bras have. And they do seem to also provide good support, which is kind of like the main purpose of wearing a bra. Well, also because they look good too, right? So like these bras and also some of the other more alternative bras. With that said, I hope these tips help. Also to leave you guys, ladies, I'm sorry, with some more tips, timing and kind of like the situation. So I mentioned like the sweat and like sports bra kind of thing. Similarly, after you have taken a shower, you're kind of wet. That may be a more difficult time to put on a bra. So same thing applies like if you have just like sweated. So temperature regulation and maybe like turning the thermostat or just the timing of things when you put on the bra and actually practice these skills may make your life easier, right? Versus like when you're like, I don't know, like 100-degree weather and you're trying to put on a bra, like it's just hard for anybody to do in those times, right? And so some other things that may help, for example, maybe like putting on some products like lotion or baby powder. I've come to practice with my patients has also been very, very helpful because it makes your skin kind of like more slippery and more like slidey to put on the bra. So those are some other tips that you can try combining with the methods that I've talked about earlier in the video. So I hope this helps. Good luck practicing and thank you so much for watching.